All right. Hi, everyone. My name is Haley. I'm a first year medical student at the University of Ottawa. And tonight we are going to be talking about lice and eczema. So I just thought I would hop on here a little bit early to give some people some time to just jump on here. Please excuse the sounds in the background. I have two kitties with me, and they're quite active at the moment. So just after 7, we will get started. All right, I will just wait a couple more seconds. People to jump on here. All right, so we'll go ahead and get started. So like I said, my name is Haley. I'm a first year medical student at the University of Ottawa. And tonight we're going to be talking a little bit about lice and eczema, as they're two common conditions that are seen in children. All right, so we'll start off talking a little bit about lice. So, lice is definitely a common problem, especially for kids, because it can spread very easily from person to person, and sometimes they are very difficult to get rid of. So, their bites can actually make a child's scalp very itchy and irritated, and that often leads to them scratching, and that scratching can ultimately lead to an infection if it's serious enough. So head lice definitely are annoying, but they're not dangerous and they don't spread disease. A very common misconception is that they're a sign of poor hygiene, but rest assured this is not the case. Head lice need blood to survive, and they don't care whether it's from someone who's clean or dirty. So, head lice are tiny insects that live among human hairs, and they feed on blood from our scalp. So, when we recognize that someone has lice or our child has lice, it's definitely best to treat it right away to ultimately prevent it from spreading. So, signs and symptoms, what are we going to look for? So, even though they are tiny insects, we can definitely see them. So the first thing that you want to look for are the lice eggs, and they're also known as something called nits. And these look like tiny yellow, tan, or even brown dots before they hatch. So lice lay nits, their eggs, on actually the hair shafts, so not on the lower ends of the hair, really close to the scalp. And that's because the temperature is perfect for keeping warm until they hatch. Nits look a little bit like dandruff, but they aren't easily removed by brushing or trying to shake them off or even trying to, remove them just with your fingers. So unless a child has a lot of head lice, it's more common to see nits in the hair than live lice crawling on the scalp. Lice their eggs hatch 1 to 2 weeks after they're laid. After hatching, the remaining shell looks like a white or clear that stays attached to the hair shaft. And this is when it's easiest to spot them. As the hair is growing longer and longer, the eggshell is moving away from our scalp. So you should examine your child's head, especially behind the ears and at the nape of the neck or at the base of the neck, for crawling lice or nits if your child exhibits some symptoms of head lice infestation. If crawling lice or nits are found, all of the household members should definitely be examined for crawling lice and nits every 2 to 3 days. So I actually got a picture. You can just generally look it up, but I found a quick picture of just what it may look like. So you can see that they do definitely look a lot like dandruff. But like I said, not easily removed by a comb or even trying to pick them out or shaking them off. So that's how you can tell the difference. So the next thing you want to look for is adult lice and nymphs, which are baby lice. Adult lice are no bigger than a sesame seed, and they're usually like a grayish white or tan color. Nymphs are smaller, and they become adult lice about 2 to 3 weeks after they hatch. And this life cycle, it repeats itself every 3 weeks. And most lice feed on blood for several times a day, and they can actually survive up to 2 days off of our scalp. So another thing you want to look for is scratching. So when a lice bites, you have symptoms of the itchiness and, scratching. And this is ultimately due to reaction to the saliva or the spit of the lice. But the itching doesn't always start right away. It depends on how sensitive our skin is to the lice. So it can even take weeks for kids with lice to start scratching. Oftentimes you may hear of them complaining of, tickling on their head or even things moving. They feel like things are moving around. You can also sometimes observe some small red bumps or sores from scratching. Some children have a mild irritation from the scratching, while others may get a rash. Scratching a lot can lead to a bacterial infection. So watching for any tender skin areas, any crusting or oozing. And at this stage, if you do see this developing, you would want to take your child to a doctor as they're going to treat that skin infection with some medication. So how can I check my child for head lice? Well, like I said, we want to look for lice and nits on the scalp. And they're usually going to be very close to the scalp, not on the lower ends of the hair, behind the ears, as it's a common area where they can hide, and around just the base of the neck. It is very rare for lice to be hiding in our eyelashes, our eyebrows. It can be tough to find a nymph. Usually there aren't many of them, and they move pretty fast. So we want to look for the nits or the eggs. And like I said, they can look like a lot like dandruff or dirt. A bright light can also help with inspection or even using a magnifying glass if you have one. Or even sometimes, taking your child outside when it's the daytime might help be easier. It might be easier to recognize them. So the best way to check is by using a fine-tooth comb on wet hair after applying a lot of conditioner. You want to comb out the hair in very small sections and look for lice or nits on the comb. A little little tip here is you can wipe the comb onto a piece of tissue paper, a paper towel, or even just a plain white sheet of white piece of paper, and you might actually see them on there. If your child is itchy and you notice them scratching their head, but you're not sure if it's lice, you could take them to either a physician or nurse and have them take a look. So some symptoms. So head lice are not known to transmit any type of diseases and therefore are not a health hazard. Some people that do get lice can be asymptomatic, particularly if it's from a first infection. But itching is definitely one of the most common symptoms of having head lice. And like I said, it's because of that allergic reaction from their saliva. And it may take even up to 4 to 6 weeks for the itching to appear the first time a person has lice. So other symptoms may include a tickling feeling or sensation of something moving in the hair, irritability, sleeplessness. You may notice some sores caused by the scratching. Yeah, so those are definitely the main ones. And there's only like 2 ways to really treat lice, and that is with medication or removing them by hand. So medicine. So you can definitely try medicated shampoos, creams, cream rinses, and lotions. These are all things that are available to kill lice. There are several anti-lice products that are sold at the pharmacy without even a prescription needed, so just over the counter. So you can definitely go talk to a pharmacist, and they will, well, rest assured they will probably recommend something to help. If you do buy over-the-counter medications, be sure it's safe for your child's age, so you definitely want to disclose that to the pharmacist. Because while some over-the-counter shampoos are safe for children, such as young as 2 months, others are only safe for kids 2 years and older. So in some areas, lice have developed resistance to some medications, so this means they no longer work to kill the lice. So you definitely want to also ask your doctor or a pharmacist to recommend a medicine that is known to work in your area. A doctor may also prescribe a medicated shampoo or lotion if you're finding that maybe the over-counter medication is not working and you did take them to a physician because of very resistant lice. So the doctor may actually prescribe a medication that's taken by mouth. So whether the medication is over the counter or through a prescription, you want to always make sure that you're following the directions closely, because applying too much can be harmful and applying too little just may not work. So the other technique, removing them by hand. So removing lice and nits by hand definitely can finish the job if the medication didn't completely get rid of the lice. So you can also do these together, because sometimes medication is not 100% effective. And it's also an option for anyone who doesn't want to use a medication. And is actually the only option for children 2 months old or younger that can't use medication. So to do this, again, using a fine-tooth comb on wet conditioned hair, you want to do this every 3 to 4 days for 3 weeks after the last nit or lice was seen. Wetting the hair temporarily stops the lice from moving, and the conditioner actually makes it easier to comb the hair through. I did find some people indicating that you could try like electric combs and stuff like that. I have not found any research that these are effective, so just using something, just a simple comb, even, from the dollar store or Walmart or wherever. You also don't need to buy any special like vinegar solutions to apply to the scalp before doing this. Water and conditioner works fine. I've also I've also heard of just petroleum jelly or mayonnaise or an olive oil that people use. Sometimes these treatments also may not work. So just a few important things is do not use a hair dryer after applying some of the scalp treatments, because some treatments they do contain flammable ingredients and can catch on fire. Also, don't use any pesticide sprays or hire a pest control company to get rid of any of the lice. These can just be harmful and are not useful at all. Through my research, I also find that using essential oils such as Lang Lang oil or tea tree oil to treat lice on the scalp are not effective. They can just sometimes cause allergic reactions. So, are head lice contagious? Head lice can definitely spread very quickly from person to person, especially in group settings like schools, childcare centers, sporting activities. But they can't fly or jump. They have claws that let them crawl and cling to our hair. So they spread through hair to hair contact or by sharing even things like clothing, bed linens, brushes, hats, things of that nature. Pets can't catch head lice and pass them on to people or the other way around. So another important thing that I found, a common question, do kids have to stay home from school? So in the past, even when I was in like elementary school, kids with head lice were often kept home from school. But now it isn't recommended that kids stay home. In most cases, a child who has head lice should stay at school until the end of the day, go home, get some treatment, and return to school the next day. While they're at school, they should definitely avoid that head-to-head contact, with other children. And they can even put their hair up in a bun, a braid, ponytail, or even use like a hairnet to try and keep things contained. I have not found any convincing data that excluding children from school helps reduce the transmission of lice. But keeping kids away does add to, like the hysteria or stigma around head lice. This is something that happens. It's completely natural. Like I said, it's not associated with being dirty or clean or any of that nature. So it's best to just keep children going to school if you can. So can we prevent head lice? To get rid of head lice and their eggs and to help prevent them from coming back, we want to make sure that we're washing all the bed linens, any stuffed animals, any clothing that were used during the 2 days before you started treatment, anti-lice treatment, to just make sure that any lice that fell off before the treatment are killed. Because like I said, that they can live up to 2 days off of the scalp. And we want to wash these items in very hot water, like 54 degrees Celsius, and then putting them in a hot cycle of the dryer for at least 20 minutes. And it's important that it's a hot cycle. You can dry clean items that can't be washed or put them in an airtight bag for 2 weeks. Making sure they're also vacuuming carpets and any furniture, and throwing away the vacuum cleaner bag if your vacuum does have one of these, as some of the lice can live in there. We want to soak hair care items such as the combs that we're using, any bands, brushes in hot water. And we want to make sure that we're telling children not to share these items. Because I said that lice can definitely pass from person to person very quickly, we want to make sure that we're checking all of the family members when this is something that's recognized, and to treat everybody that has lice so they don't pass it back and forth. We also want to tell kids to try and avoid head-to-head contact at school when they do have a lice infestation, and while playing at home with other children, siblings. So every 3 or 4 days, we also want to make sure that we're checking the children who had close contact with a person who's had lice, and then treat them. Treat any who have had lice or nits close to the scalp. So will they ever be gone? Well, fighting a head lice can definitely be an ongoing battle, and there's no doubt that they can be tough to get rid of. If you tried everything and your child still has lice, it can be due to some nits were maybe left behind, no, excuse me. So there's still live lice. Your child still has been around somebody that has lice, or maybe the treatment that is being used is just simply not effective. But if your child has had lice for 2 weeks after you started the treatment and you're doing the regimen, and your child's scalp looks infected, you definitely want to call a physician. So just some key things here. I think it's really important that we always remind children that having lice it's normal. Anybody can get them, and because it can definitely be embarrassing. Again, having head lice is not a sign of dirtiness or poor hygiene by any means. Okay, these little bugs can definitely be a problem no matter how often kids wash their hair or bathe. Dealing with head lice can definitely be very frustrating, and it's important to be patient, follow the treatment regimen, and prevention tips discussed within this session or from your physician or nurse. And hopefully soon your family will be lice free. So that's it for the lice section. And now I'm just going to give a brief overview of what eczema is, which is another very common condition seen within children. So eczema is a condition where the skin gets irritated, dry, red, bumpy, and can also be very itchy. There's several different types, but the most common type of eczema is known as atopic dermatitis. So some signs of eczema are mainly dry, itchy skin, redness, maybe some scaling, some bumps that can leak fluid or crust over. Eczema is definitely something that tends to come and go, and when it gets worse, it's known as a flare-up. So symptoms can definitely vary. In infants younger than 1 year old, they usually have eczema on their cheeks, their forehead, or their scalp, and may even spread to the knees, the elbows, and trunk, but is usually not the diaper area. Older kids and teens usually get the rash in the bends of the elbows, so here, behind the knees, on the neck, or even the inner wrists and ankles. Their skin is often scalier and drier when eczema first begins, and can also be thicker, darker from all the scratching. So what causes eczema? Well, it's a great question, and clinicians don't actually know the exact cause. There's some speculation that it might be from a reaction of the person's immune system, or from skin allergies that might be involved in some forms of eczema. So who gets eczema? Many people do. It's very common. Some experts think it can actually be passed from parents to kids through genes. People with eczema also may have asthma or other types of allergies. A common one is hay fever. Eczema, asthma, and hay fever are known as atopic conditions, and these affect people who are overly sensitive to allergens in the environment. For some, food allergies may bring on or make these worse. But for others, allergens to animal dander, dust, pollen, or other things may be a trigger. Eczema is not contagious. And before I get to the diagnosis, I just wanted to show you a couple pictures here of different, well, eczema, atopic dermatitis. So this is just on a child. His cheeks. And this is within the elbow. Here. So as you can see, it can prevent definitely many different ways. And that was just actually on the back of the knees. So how is eczema diagnosed? Well, there's actually no specific test. The physician will actually look at the rash, ask you about symptoms, the child's past health, the family health, asking any family members if they have similar conditions or those atopic conditions that we talked about, such as asthma or other allergies. And that's an important clue. The doctor will also rule out other conditions that can cause common skin inflammation and actually might recommend that your child may see a dermatologist or allergist. They can also ask about eggs, milk, soy, or nut allergies from, if you've noticed that your child have had any reactions to these things, or may recommend switching detergents or soaps to see if your child's reacting to something. So how is it treated? Ooh, sorry. Well, there's actually no cure, but some treatments may help with the symptoms overall. Your physician may recommend different treatments based on how severe the symptoms are, the child's age, where the rash is. Some treatments are a topical, where some are taken by mouth. So topical moisturizers, the skin should definitely be moisturized often, ideally 2 to 3 times per day, which I actually found that shocking because I find that quite a lot. And the best time to apply moisturizer is after a bath or shower when the skin is patted dry. Ointments such as petroleum jelly or creams are the best because they contain a lot of oil. Topical corticosteroids might be something that's prescribed by the physician. They're also called cortisone or steroid creams, and these basically help calm the skin's inflammation. These are not the same as like steroids used in athletes. And these creams and ointments definitely vary in strength, and using the wrong strength in very sensitive areas can damage the skin. So you want to make sure that you're following the physician's recommendation and not overusing. So medications taken by mouth, these are known as antihistamines, and this helps with the itchiness, can help the kids sleep better at night. Antibiotics may be used if a rash gets infected, or corticosteroid pills to help with the inflammation, or other medications that can suppress the immune system. Other types of treatment can include phototherapy, so using some UV light, wet wraps, so using just a damp cloth placed on the irritated skin, which is something that's very easy to do at home. Bathing in a very diluted solution, even using some oatmeal in a bath can help soothe the irritation. So how can we prevent eczema by keeping your child's skin from getting dry or itchy and avoiding some of the triggers that can cause the flare-ups? So kids should try and take short baths or showers in warm, not hot water, and use a mild unscented soap. And definitely pat the skin dry before using the cream or ointment. Kids should definitely wear soft clothes that breathe, that are usually made from cotton, not something like wool or polyester, because sometimes that could just be too harsh and it can actually be more irritating. We want to keep their fingernails nice and short to prevent any skin damage from the scratching. Try having your child wear some very comfortable light gloves to bed if scratching at night is a problem. Kids should also avoid becoming overheated because this can also cause flare ups. Make sure they're drinking plenty of water because that adds some moisture to the skin. And get rid of any known allergens in your household to help prevent those triggers. I also found that stress can make eczema worse. So, helping your child deal with stress can prevent the flare ups. Sometimes, some deep breathing exercises or, just talking to someone about it. Maybe doing some exercise may help. So, when should you call the doctor? Well, children and teens with eczema are prone to skin infections, so we want to make sure that you're calling a physician right away if you notice any early signs of a skin infection, such as fever, so usually, 38 degrees or over, any redness or warmth around the affected areas, any pus-filled bumps around the areas, or even sometimes they can look like blisters. You also want to call your doctor if you notice any sudden change or worsening in the eczema, or if it isn't responding to maybe some of the treatments. So just some other things that I found, which were interesting, is that eczema usually begins to improve by the age of 5 or 6. Sometimes people will have it when they're younger and it completely resolves itself. In other children, it can start as early as puberty. And some people even have eczema as adults. And that is completely normal. So that is all the information that I have on lice and eczema. I hope that you all learned something, and hopefully your children never have this, but they are very common, and if they do get it, you can use some of the tips and tricks just discussed in the session. So I'm just gonna have a look at the chat. Awesome. Yeah, I have 2 cats, Bojangles and Tigger. Yeah, we were always told to keep long hair braided. Is this true? I guess I'm not really like when the person is going to school, like just generally, no, you don't have to. It's not something that I would foresee, um, preventing getting lice. And yeah. Okay, awesome, everybody. I hope everybody has a great evening. And thank you so much for joining. Take care.